Welcome, everybody, to 2019 options for individual clients. As we get started with this presentation, I do want to make clear that I am talking about the year 2019. I do not have 2019 different options for individuals. Unfortunately, the options in the individual market are somewhat limited. But in this class, we're going to talk about what's out there, what's available, and really, which clients might go with which solution. So, hopefully this will be something that kind of makes sense and helps you as you're, as we enter the busy time of the year and the open enrollment period in the individual market. Hopefully this will help you to more quickly and easily identify which clients belong with which solutions. So we're doing this class as part of our 10-part series on employer solutions. And it sounds a little weird to be talking about individual in the middle of that, but there is a reason. Okay, so if you think right now about how people get insurance, there's a lot of different ways, and this is not a comprehensive list, but it's a pretty good list, right? I mean, there's both private and public options. Some people buy insurance on their own, either on a group basis or an individual basis. A lot of people get coverage through a government program like Medicare or Medicaid or CHIP. Well, if you look at the public sector or the public side of things, the public solutions, there are roughly 44 million people that get coverage through Medicare. There's about 67 million that get coverage through Medicaid. Of course, that's more than it used to be. The Affordable Care Act expanded Medicaid in many states and certainly brought awareness to the program. There's another 6.5 million people that get coverage through the Children's Health Insurance Program. That's a big chunk of the population that is in some sort of what many people call an entitlement program. Certainly, these aren't all handouts. Medicare, for instance, is something we pay into all our lives. We pay for after we're receiving it, but nonetheless, it's a government-provided solution. On the group side, there are about 156 million people between the small and large group market that get their coverage, through their employer. On the individual side, there's only about 21 million people, and that number is going down a little bit as the number of people signing up through the marketplace drops a little under the Trump administration for a number of reasons. But 21 million when we're looking at a country of whatever it is, 330 million people, 21 million people in the individual market, that's not all that many. But, to hear the government talk or to hear the media talk, you would think that everybody gets coverage through the individual market. That is where almost everyone's attention is focused when we discuss the Affordable Care Act. Looking a little more at these public programs, under the Trump administration, there have been some changes and some proposals. Medicare, there are some proposals right now that would privatize portions of Medicare or at least create a private option. One change that we know is in the works is that in 2020, Medicare supplement plans C and F are going away. Those are the ones that pay the upfront Part B deductible. Plan F is the one that basically fills all the holes in Medicare, and the government has decided that they do not want a plan that pays everything because people tend to overutilize. This is the moral hazard characteristic of insurance. If people have insurance, they tend to use it. If people have insurance that pays everything, they tend to use it more. Right, so the Medicare supplement Plan F for anybody new to Medicare will not be available starting in 2020. So that's kind of what's happening with Medicare. Medicaid, there's Medicaid work requirements now that was passed at the federal level. We see that being implemented in a number of states. There are some states talking about rolling back the Medicaid expansion that came with the Affordable Care Act. There have been cuts to the Navigator program. The Navigators, of course, are the ones that, you know what? It says that my voice is fading out a little bit. So here's what I'm going to do. I'm going to go ahead and call in. So I will let everybody look at the pretty slide here for a second, and then we will give me just a moment, and I'll be right back. Thanks.
Okay, I am back. For those who are having trouble hearing me, can you hear me any better now? I've called in through my phone rather than using the microphone. So hopefully this will work a little bit better. Let's see. Yeah, a couple people are saying it's all good. So hopefully that is the case. Okay, so the same people that were having trouble say that it's still messed up. That sounds like it could be a problem on your end if maybe you have bad phone connection, or if you're listening through your computer, that could be the case. Unfortunately, it is what it is. So I'll talk directly into the phone, and hopefully we'll get through this, and most will be able to hear me. So Medicaid. Again, there's cuts to the Navigator program. Navigators are the ones that we're going out and meeting with a lot of people and getting them signed up for Medicaid, or getting them signed up for the Children's Health Insurance Program. And so, certainly if we, cut that program, then that could hurt Medicaid enrollment. The Children's Health Insurance Program, it was sort of held hostage late last year. Lawmakers allowed the program to expire for several months. States started scrambling, trying to figure out what they would do before it was reauthorized. And so, the people who get coverage through public programs, they are not completely without worry. There's always some sort of discussion about cuts to the programs or different ways to do things. In the private market, certainly a lot of people get coverage through small group and large group plans, but the truth is that not a lot is going on there. There's a few changes, a few new solutions in small group, association health plans, that could be promising. We see small and mid-market employers looking at solutions like captives, but there was no legislation that changed that, that has really impacted those groups. The most of what's happening, most of the legislative changes that we could report are happening in the individual market. And so I think that, even if you focus on group, if you sell more small and large group than you do individual products, I think that there's still three very good reasons to talk about individual, to learn what's going on in the individual market. One reason is because what's happening in the individual market, ultimately for an employer, it impacts what your employees think about your group plan. In other words, if there's a great individual market and premiums are low and the government helps to pay a portion of those premiums, then employees might value your group plan less. They may appreciate it less because they have other options. However, if in the individual market prices are high and there's no PPOs available and the out-of-pockets are high and people can't qualify for tax credits, then you know what? The group plan looks really appealing to them. So what's happening in the individual market impacts employee attitudes about group health plans. So that's one reason to just understand what's going on there. The second reason, I think, is because, as I already said, the government and the media seem to think that the ACA equals the individual market, that they're the same thing, or that the individual market and healthcare.gov and all of that stuff, that's everything that there is to the Affordable Care Act. That's certainly not true, but that is where all of the attention is. And so basically, I don't think it's a stretch to say if the individual market fails, then so does the Affordable Care Act. So that's a pretty good reason to keep an eye on what's happening there. And then finally, what's happening in the individual market, the segmentation that we're seeing there, I think is a good preview sort of what's going to happen in the group markets. And we're already seeing it in small group as, unhealthy groups might stay with a fully insured metallic plan. Healthier groups might go to level funded plans. Groups with good demographics might go to association plans. So there's this sort of natural segmentation in the small group market. It's really happening in individual, and so it's a great reason to look at that market. It can kind of inform us about group. So really the overriding theme, I think, in the individual market right now is sabotage. President Trump and his administration and congressional Republicans, really, they've been trying to sabotage the Affordable Care Act in general and the individual market in particular for the last several months. Republican lawmakers, they look at the results in the individual market. They look at the premiums and the out-of-pockets and so forth, and they could easily make the argument the wheels are coming off the ACA. At the same time, supporters of the ACA might look at it and say, yeah, but you're loosening the lug nuts. It's because of your sabotage efforts that we're actually seeing all of these negative results. Basically, these sabotage efforts have created mayhem in the individual market. Premiums are going up, and there's fewer options than what we've had in the past. So when I say individual premiums are going up, what do I mean? What kind of proof do I have of that? Well, if you look at the 2018 premiums, bronze level premiums went up about 17% nationwide. That's 17% in 1 year. That's a pretty big amount. Gold plan premiums went up about 18% nationwide. Silver level premiums, 32% increase. Well, the reason for that, of course, is because in the silver level, that is where, I don't know where my computer is doing this. Sorry. In the silver level, that is where people get cost sharing subsidies. And we all know that what happened in late 2017 is President Trump said that he is going to stop reimbursing insurance companies for those cost sharing subsidies. You only get those in the silver level. Carriers are prohibited by the Affordable Care Act from raising the premiums just on those plans, where they provide the cost sharing subsidy. So what they decided to do is increase the price across the board on silver level plans. Well, that actually ends up helping those that receive the tax credit. And the reason is the tax credit caps what people pay for the second lowest priced silver level plan in the marketplace. So if somebody were to purchase that plan and they're at, $25,000 a year, 207% of the federal poverty level, they're going to be capped at a certain percentage of their income. If the premium on that plan goes up by 32%, it doesn't matter, because as long as the person's income doesn't change, they're still capped at the same amount. They would keep paying the same amount for that plan. However, the tax credit grows because the government picks up the difference between what the person's capped at and what the total premium is. That becomes the tax credit amount. Think of that as being something that the government just loads onto a gift card and gives to the consumer and says, well, you can use it for this plan or you can use it any other plan you want. So what that means is if the consumer goes and buys another plan, maybe a bronze plan, maybe a gold plan, whatever, then the premium for those plans is actually lower relative to what it was last year, because while the premium went up, the tax credit went up by more than that, and it more than offsets the premium. So What that means is, if you look at, let's say, a 40-year-old who makes $20,000 a year, 166% of the federal poverty level, after accounting for the tax credit, that person's bronze level premium actually dropped by 85% in 2018. The gold premium dropped by 26%, silver dropped by 14%. As you go up the income scale, it's a little bit less of a difference, but it's still pretty big. I mean, a 40-year-old that makes $30,000 a year, 249% of the federal poverty level, saw their bronze level plans decrease by 50% after accounting for the tax credit. Gold's dropped by 16%. So basically, all plans just about are less expensive for those receiving the tax credit. You know, even the lowest cost gold premium is lower than the lowest cost silver premium in 478 counties because of the adjustments that were made to the silver level plan. So we've seen basically the net cost to everybody go down if they're receiving a tax credit, and we see gold plans priced lower than silver level plans, which is weird, right? Turns out that after this higher tax credit that came with the higher silver level premiums, there's a lot of people nationwide that are actually getting free care or free coverage in the individual market. For people at 166% of the federal poverty level, there's 2,400 counties nationwide that offer a free plan to them in the bronze level. For people making $25,000 a year at 207% of the federal poverty level, 1,679 counties offer free coverage for the bronze plan. So there's a lot of people that, while they're not on Medicaid, they're still getting free healthcare coverage. Of course, what this also means, though, is everybody else, everyone not receiving a tax credit, ends up paying more. There's higher premiums for those not receiving a tax credit. How high? Well, guess what? In the DFW area, these are the Blue Cross rates. You know, Blue Cross is one of the carriers that is still offering individual health plans in the state of Texas, and yeah, I'm sorry, I was trying to read a question here, and I'll answer it here in just a second. But Blue Cross is one of the plans that is still offering individual plans in the state of Texas. Well, they have 8 or 9 plans. 3, 4, 5, 6, 8 plans in the DFW area. Those plans for a 40-year-old range from $410 a month all the way up to $727 a month. For a 45-year-old, $464 to $821. A 50-year-old, $573 is the lowest price plan. It goes up to over $1,000. There's a 77% spread between the lowest price bronze plan, which offers, 2 office visit copays, has a $5,600 deductible and a $7,350 out-of-pocket limit. There's a 77% spread between that plan and the highest price plan. That's all really expensive, and those are all HMOs, right? If you compare the cost of that lowest priced bronze level plan in the individual market, and then you compare that with Blue Cross's HMO small group plans, there's only one small group plan that's more expensive than their least expensive individual plan. There are some plans that are, 22, 36, even 40% lower in cost than the individual market. So comparing individual to small group, it's really no comparison. For like plans, there's really not like plans. The plan designs don't look exactly the same, but these are HMO plans compared with HMO plans. Small group is less expensive and in many cases offers better coverage than in the individual market. So for those receiving a tax credit, they saw their premium go down. So one person had asked the question. They said they thought that the tax credits were only available in the silver level. So there's 2 different things, right? There's premium tax credits and cost-sharing subsidies. Premium tax credits, you can buy any plan you want, bronze, silver, gold, or platinum. It's just that the dollar amount of the tax credit is based on the difference of the price that someone's capped at in the silver level for that second lowest price plan versus the total cost of that plan. So the government picks up the difference after, what the person's capped at, and that becomes a tax credit amount that they can buy a bronze, silver, gold, or platinum plan. The cost sharing subsidies are only available in the silver level. So if somebody's willing to forego the cost sharing subsidies that they might qualify for, they might be able to buy bronze level coverage and get it for free after accounting for that higher tax credit. So basically, it can be good news for people getting a tax credit. People not receiving a tax credit pay an awful lot more, and individual rates, as you can see, are quite a bit higher than the group rates. Okay, so if you sell individual and small group, and someone has the option of a group plan, group is going to save them money much of the time. Okay. In addition to premiums going up in the individual market, out-of-pockets are going up. Now, this impacts groups as well, but if you look at the out-of-pocket limit, which on a lot of those plans, they adopt this as their out-of-pocket maximum, it's going up from $7,350 out-of-pocket limit in 2018 to $7,900 in 2019, twice that amount for family. So the family out-of-pocket limit is going up by $1,100 in just 1 year. That's a really, really high amount for people to have, that much exposure after paying really high premiums. As we all know, copays are disappearing on most plans. So, in many cases, you're having to pay the contracted price at the doctor or the pharmacy. Some of those plans are HSA compatible, some are not. For those plans that, adopt the $7,350 or next year $7,900 out-of-pocket limit, that's higher than the HSA qualified plan out-of-pocket limit. So even though it might be a high deductible plan with no upfront co-payments, it may not be HSA qualified if the out-of-pocket exposure is too high. Another trend that we've seen is that PPO networks are disappearing in the individual market. Pretty much what we're left with is HMOs, and those are smaller networks, but also no out-of-network option. So if somebody needs a facility that isn't in the network, they may not have that as an option in the individual market. Over the last couple of years, we've actually seen a slight uptick in the uninsured rate. It had dropped pretty significantly after the Affordable Care Act was signed into law. Now we're starting to see it creep back up again. In fact, there was a study done by the Commonwealth, what is it called? Commonwealth Fund, and it shows that the number of uninsured over the last 2 years has gone up by about 4 million. So we are kind of going in the other direction now. So the one other big thing, I guess, to report in the individual market is a lot of carriers have left. If you contrast that with the small group market, fully insured ACA metallic plans, a lot of carriers are still there offering those plans. Some of them have priced them in such a way that nobody's going to want to buy them, right? Because they're focusing their attention on level funded plans. On basically they're catering to healthier groups and doing the ASO model as opposed to offering the fully insured plans, but they maintain a presence in the small group market. That's actually different from what we're seeing in the individual market. A lot of the major carriers have just stopped offering individual plans altogether. So you look back a couple of years, Cigna and Aetna and Humana and United, they all had plans in the individual market. They've all pulled out. So you still have Blue Cross. You have a couple of other carriers offering individual plans, Taylor, Scott and Line and Molina and Better, but there's just not an awful lot. Blue Cross Blue Shield is the one kind of brand name carrier that's left statewide, and then we see some regional carriers and some newer entrants in the market, but there's just not a lot. So I guess if you look at everything we just talked about, higher premiums, higher out-of-pockets, fewer co-payments, smaller networks, fewer options being offered by the carriers, fewer carriers participating, all of that stuff seems like bad news, right? I mean, it's hard to look at that and say, wow, things are going great. President Trump, when he looks at that, he says, well, good, right? Because President Trump has no secret that he does not like the Affordable Care Act. He promised during his campaign to repeal the ACA on day one of his presidency and to replace it with a much better solution, much better coverage at a much lower price was the promise. That hasn't happened yet, right? I mean, it hasn't. I've spoken to a number of groups before and said, raise your hand if you think we're going to see much better coverage at a much lower price. Nobody ever raises their hand. Everybody kind of chuckles at it, but there was at least the hope that it would be replaced with something better. That has not happened. That's not from lack of effort, though. President Trump has absolutely tried to repeal the ACA and has supported some of the replacement efforts. But whenever he hears this news, he hears about the higher premiums and out-of-pockets and fewer people signing up for individual coverage. He says, well, good. Let Obamacare fail. That is something that we have heard again and again and again. Now, with all of that said, I am not criticizing that as a strategy. It is possible that that's the best thing to do, right? I mean, last summer, the president backed the GOP efforts in the House and the Senate to repeal the health reform law. The bill did pass the House. It failed in the Senate on 3 separate attempts. So since that time, basically, President Trump said, well, fine, then if we can't do it in total, what we'll do is break it apart piece by piece. And he's really drawn on all 3 branches of the government to do that. We've seen some legislation passed that repealed a big part or a big major component of the ACA. We've seen different things happen on the regulatory side, and we've seen a court case that could undo parts of the ACA. So really all branches of government are involved in this. I'm so sorry, my computer keeps doing that. But again, it doesn't mean it's the wrong approach. It doesn't mean it's the right approach. So I'm not taking sides here. There's plenty of opinions to go around, and you might say that, well, if they can't repeal it all at once, they need to break it apart. And others would say, wait a minute, these are consumer protections, and if you don't have a good replacement plan, don't break what's already there, right? So there's definitely arguments on either side. Here's the one thing that I don't think we can argue. I think that the current effort is focused on undoing, not fixing the ACA, right? I mean, that is not the goal. The goal is not to repair the Affordable Care Act. It is not to fix the individual market. The goal is to break the individual market, but maybe offer some Band-Aid solutions in the meantime. I think over time, it's going to lead to fewer options and higher premiums, and that is something that we are seeing, right? Perhaps this continual chipping away at the ACA will ultimately cause it to collapse, and that's going to force lawmakers to introduce a new solution. As it stands now, though, consumers are caught in the crossfire, and every year it's a different thing. Everybody has to kind of learn what's going on now, and they have to make decisions 1 year at a time, as opposed to kind of coming up with a long-term solution. So, excuse me, right now, the Affordable Care Act is still the law of the land. You do kind of have to wonder how long it can survive, though, given all of the attacks. So right now, the ACA is 8 years old. It turned 8 in March. Most of the major provisions are in effect. There's a couple that aren't yet. So, for instance, if somebody had a grandfathered or transitional plan, that they haven't moved into the ACA metallic plans. The Cadillac tax has been postponed again and again, so it hasn't yet gone into effect. Pretty much everything else is in effect. President Trump, he says and has said, well, the ACA is basically dead, right? I mean, and, he's basically already pronounced it dead. It's not really true. At the same time, there's a lot of stuff that is kind of dead and gone. There are provisions that never went into effect. There's provisions that fizzled out. There's provisions that have been repealed. Cadillac tax has been delayed. So there's definitely some stuff that, we were talking about a few years ago when the ACA was passed that we thought would be a big deal that never really became a big deal. right? So, I mean, it's already is a kind of a shell of its former self, but the big stuff, if we had to quickly summarize what does this law do, back in 2010 when it was first passed, most of the things that we would have said when we were mentioning it, those are still alive, right? The one big thing, the one big provision that has been repealed is the individual mandate. Not the mandate itself, it's still in place, but the penalty associated with not having health insurance, that goes away starting in 2019. That was part of the Republican tax bill that passed at the end of 2017. So the individual mandate is the one big one that's gone, but all those other provisions that were important, the really big ones, guaranteed issue and modified adjusted community rating and essential health benefits, the marketplace, the tax credits and subsidies and the employer stuff, the mandate and the reporting, all of that stuff is still in place. So in one way you could look and say, well, clearly the president is wrong, and when he says the ACA is dead, because these are the big things and they're still there, right? I mean, you could make that argument. Another way to look at it, though, is this was a 2,500-page bill, and I'm able in bullet points to fit the major stuff, the important stuff, on just one slide, right? I mean, what is that? That's 8 things. Well, if there's only a few things that are really important in the ACA, then if you're not going to take the approach of repealing the whole thing at once because you don't have the votes, then what you can do is start attacking those one at a time. And that's kind of, I think, what Republican lawmakers have realized, that, they can have a big impact on the law just by focusing their efforts on a few of the key provisions. And so over the past year, ever since the repeal efforts failed last summer, we have seen this continual chipping away at those provisions. Last summer, Paul Ryan led the efforts in the House to repeal the law and was successful at passing the American Health Care Act. The problem was the public absolutely hated it. It had a 17% approval rating. There were angry town hall meetings, people yelling about, taking away their health care. And so when the Senate got this, they said, forget that. We are not going to vote on the American Health Care Act. We're going to write our own bill. And so they went behind closed doors and worked on it, and they came out with basically the same exact bill. I mean, it was very similar to the American Health Care Act. It was called something different, but it was a Better Care Reconciliation Act of 2017 or something like that. It was basically the same bill, and it had basically the same approval numbers. It really didn't resonate with the public. So the Senate ended up holding 3 different votes on it, and ultimately the Senate's versions of the bill ended up failing. The now late, great John McCain, of course, right out about a year ago, he cast the deciding vote on the skinny repeal bill. So basically the repeal now, replace later, the Better Care Reconciliation Act, and the skinny repeal bill, all 3 of those ended up failing in the Senate. And so again, lawmakers just kind of adjusted their strategy, and they said, let's attack this thing one piece at a time, and that is what has happened. So how have they done that? Well, the marketing budget has been cut and then cut again. When President Trump took office, there were ads that were already paid for the 2017 enrollment period, and they actually canceled some of those ads for last year. At this point, the marketing budget has now been cut by 90%. Well, why do you need to market it? Don't people know they need health insurance? Sick people know, right? If somebody's sick, if they've got medical conditions, they're going to sign up for coverage. It's the young, healthy people, the young invincibles, those that are bulletproof. Those are the ones that we want to sign up for coverage because they're the ones that are less likely to use it. And if they're participating, that'll lower the price for everybody, right? So they're the ones we need to market to. But if you cut the budget, then you're not marketing to them as effectively. And so that can make the price go up. That's one of the, what some would call a sabotage effort. The cuts to the Navigator program. Now, I know brokers have never been big fans of Navigators, part of that is because we originally thought navigators were going to take our place. I remember teaching classes back in 2010 and 2011, and brokers were just in this panic about navigators. Are they going to be competing with us and taking our business? Should I go become a navigator? That was a common question. Navigators have not, for the most part, taken business from brokers. A lot of what navigators would do is go out and reach those populations that we might not be reaching, the people that need Medicaid and CHIP. Well, that program has been cut by 70%. The cost sharing reductions, I mentioned that in 2017, right before the open enrollment period, President Trump decided he was going to stop reimbursing insurance companies for providing these enhanced plans to people who are below 250% of the federal poverty level. Basically, if you make less than 250% of the FPL and you buy coverage in the silver level of the marketplace, you get an upgrade to your plan. So it doesn't cost any more, but you get a higher actuarial value and lower cost sharing amount. So lower deductible, lower out of pocket, higher copay, more upfront copays, that sort of thing. So you get a better plan, but it doesn't cost more. Insurance companies are prohibited from charging more for those particular plans. So they're providing this better coverage. What the government's supposed to do then is look at the actual claims that come in, as well as the higher utilization that comes with having a more comprehensive plan, and they're supposed to reimburse the insurance companies for providing those better benefits to lower income individuals. So the insurance companies do their part. They deliver on the product. They give people the better coverage and pay those claims, and now the government is not reimbursing them anymore. And so what carriers said is, well, okay, if you're not going to pay us back and we can't charge more just for those plans, we'll just charge more for all silver level plans, because the cost sharing subsidies are only available in the silver level. So across the board, they charged more. Well, for those getting a tax credit, we already saw it really doesn't hurt them. But for people who don't get a tax credit, now their silver plans cost more, whether they're buying coverage through the marketplace or outside the marketplace. So it raised the price for everyone else. And that, has, that certainly impacts the decision of people to enroll. Again, sick people are still likely to sign up for coverage. Healthy people are less likely to. So they decide to go uninsured as a result. We got a scare recently with the risk adjustment payments. This is a program that's set up for the individual and small group market, because with guarantee issue, the insurance companies have to take people regardless of health status, right? And so it follows that some insurance companies are going to get more bad risks than others. So they're going to end up with higher claims. So all of the carriers pay into this fund that basically is then distributed based on the relative health of the people the insurance companies are taking on. And so if a company gets a lot of bad risk, they'll get money paid to them from this risk adjustment program. It's about $10 billion program. And for a while, the Trump administration decided they were going to suspend or freeze these payments. So now the insurance companies weren't getting paid for the bad risks. This, again, was happening at the time they were making the decision about whether or not they wanted to offer coverage and what they would charge for that coverage for 2019. There was a lot of outcry about this. A lot of people were upset about the decision. And so there was an announcement that they are going to resume the payments around October 22nd, but they did say now they kind of want to get the public's input on it. So there's this constant sort of confusion in the marketplace that is happening from all these changes, constant changes really, to the way things happen. One of the big ones, as I mentioned, the individual mandate penalty is going away starting in 2019. That penalty started at $95 per adult, or 1% of the household income in 2014, rose for the next 2 years, and is going to zero, though, starting in 2019. Now, this isn't done from the regulatory side. This is being done from the it's being done from the legislative side. So that's the second branch of government to get involved. with that penalty going to zero, there are some predictable results, right? If you still, the insurance companies still have to take the sick people, but the healthy people no longer have to sign up, then that means there's going to be some healthy people that decide to drop their coverage since there's no requirement. Now, when that happens, that leads to adverse selection. With adverse selection, prices go up. Well, with that said, Larry Levitt with the Kaiser Family Foundation, he made I think a really insightful observation. I follow him on Twitter, and he makes a lot of comments on there. And one of the things that he said is that, yes, across the country over time, as a result of the individual mandate going away, premiums will increase. But last year, with a cost-sharing reduction deal, carriers already increased their premiums to compensate for that, and some may have overcompensated. They may have overcorrected and charged too much for 2018, and so they may not need to charge as much for 2019. So, yes, the individual mandate penalty going away is going to have an impact on premiums, but it may not be an immediate impact because of the overcorrection last year. And lo and behold, that is what happened. It appears with, in the Texas market, Blue Cross Blue Shield, after years of double-digit rate hikes, has now announced that in the individual market, for the first time since 2014, they're decreasing premiums by an average of 6%. So, it sounds crazy that at the time that the mechanism that was meant to keep premiums under control goes away, that's when we actually see the decrease. But again, it has a little more to do with the timing of of this change and the fact that it's occurring the year after there was a big adjustment already. So either all adverse selection has already been accounted for and the mandate just wasn't as big a deal anymore because there was weak enforcement of it anyway. It's either that or Blue Cross may have overcorrected last year in anticipation of the cost-sharing reduction payments being halted. So hopefully that makes sense. I mean, but basically, carriers are trying to figure out how to adjust to these fairly regular changes now. There is another lawsuit, and it has resulted, I'm sorry, I don't know how to make my computer not have the box pop up. There has been another lawsuit filed. This has to do with the individual mandate. Basically, on February 26th, Texas filed a lawsuit along with 20 red states that says that because the individual mandate penalty is going to zero, the mandate is actually unconstitutional. And there's sort of this chain of events here that could jeopardize the health coverage for 52 million Americans with pre-existing conditions. Let me explain if I can make this thing stop. Okay, so this all kind of comes back to this 2012 Supreme Court decision. In 2012, opponents of the Affordable Care Act sued the Obama administration and went all the way to the Supreme Court. They were saying at the time the individual mandate is unconstitutional. The Supreme Court said, no, it's not unconstitutional because it falls under Congress's authority to tax. The individual mandate is a tax because it generates some revenue for the federal government. Fast forward to 2019, the individual mandate is still in effect, but the penalty is going away, so it will no longer generate revenue for the federal government. And so now the argument is, well, if it doesn't generate revenue, then it's not a tax. If it's not a tax, it's not constitutional because you can't force people to buy something that they don't want, right? So that's the argument. Now, the Justice Department, the way it normally works is when somebody files a lawsuit against the federal government, over one of our existing laws, the Justice Department defends the law. They may not like the law, but they still defend the law. And if the law changes or if somebody wants the law to change, then Congress has to do that. If Congress changes the law, then the government will then defend that law. But that's not what's happened in this situation. The Justice Department said, you know what? We actually agree with the plaintiffs, so we're not going to defend this lawsuit. And then beyond that, what the Justice Department did is they filed a brief with the court, 22-page brief on June the 7th, and they said, hey, not only do we think the individual mandate should be found unconstitutional, while you're doing that, they asked this of the court, could you also throw out guaranteed issue and community rating? We don't think those should be allowed either. And basically to do that, to make that argument, they drew on the other Supreme Court case about the Affordable Care Act. It was the 2015 King versus Burwell case that went to the Supreme Court, where they found that the premium tax credits are constitutional and can be offered in all states, regardless of whether they have a state or use the federal exchange. In the majority opinion in that case, Justice Roberts, he wrote that Congress made the guaranteed issue and community rating requirements applicable in every state of the nation, but those requirements only work when combined with the coverage requirement and tax credits. It thus stands to reason that Congress meant for those provisions to apply in every state as well. So the Justice Department is arguing that, hey, the Supreme Court's already confirmed congressional intent was for all three provisions to be in place. If the individual mandate is no longer in place because it's unconstitutional, then you've got to get rid of guaranteed issue and community rating as well. So they kind of worked backwards here, and they said, it was a three-legged stool. One of those legs is gone, so you've got to pull the other legs out as well. Some people agree with that argument. They said, well, that certainly makes sense. I mean, the Supreme Court kind of figured out congressional intent whenever they were ruling on the tax credits. They said all three provisions go together, get rid of the mandate, you got to get rid of the others. Other attorneys look at this and they say, well, yeah, but when they got rid of the individual mandate penalty, Congress was voting at that time. They had the opportunity at that time to also get rid of guaranteed issue and community rating. They didn't do it. So we don't need to look back to 2010. We just need to look to 2017 to figure out congressional intent. Congressional intent clearly was to get rid of the penalty but leave the other stuff in place. So we'll see what happens. I mean, ultimately the court could side with the plaintiffs in this. And if they side with the plaintiffs, the ACA is basically dead, right? I mean, the biggest provision in the Affordable Care Act was the guarantee issue provision. And if they get rid of guarantee issue, it'll have a big impact, not just on the individual market, but the group market as well. Well, ultimately, no matter how the lower court rules, this could find its way to the Supreme Court. And that's part of the reason that, the next pick to fill that ninth slot at the Supreme Court is so important. Justice Kavanaugh, there's no way to know for sure how he will rule, but based on some of the statements he's made and prior rulings, the guess is that he would side with the Justice Department against the Affordable Care Act in this situation. This ultimately could be an election issue. It turns out that about 2/3 of voters oppose the Department of Justice's move to get rid of the protections for people with pre-existing conditions. So certainly this will be something that's on some people's minds. Ultimately, if guarantee issue fails, that's going to impact the small group market and the large group market as well. But in the meantime, this is just one more distraction. It's one more thing that causes uncertainty in the market. When there's uncertainty, prices tend to go up. Another election, just since I'm mentioning that, another election issue is going to be Medicare for all. Bernie Sanders sort of made this a mainstream issue during his, presidential run. He continues to advocate for it. Others do as well. In Texas, during the Democratic primaries, they kind of polled the base. There was a non-binding resolution where they asked, do you think that everyone in Texas should have a right to health care guaranteed by a universal quality Medicare for all system? And 95% of Texas voters voting in the Democratic primary said, yes, they are for that. They believe in that. Ultimately, you can split the base because it's a good primary issue, but when you go to the general election, the worry is that some people would see this as socialized medicine, and they might not embrace that. And so there is an argument that this could split Democratic voters. Republicans did do their own polling in the Republican primary, and they asked, should Congress completely repeal Obamacare? 87% of Republican voters said yes, and 13% said no. Now, we've recently seen that apparently that number may be shifting a little bit, and more people seem to be supporting the existing law, but it's still very much a Democrat versus Republican issue. A couple other things that are worth mentioning with the individual market. Short-term health plans. We recently got guidance on that. President Trump, back in October of 2012, he issued an executive order where he called for expanding HRAs and association plans and short-term health plans. And we got the final rules. They're expanding these short-term plans from 3 months to 12 months, 364 days, and they can be renewed twice. So basically up to 3 years. Short-term plans, they are a good solution for healthy people, but in the past haven't really been a great solution because of the individual mandate. They didn't count as qualified coverage. Here, if you take the attitude that, all of this is, an effort to sabotage the Affordable Care Act, well, in that case, two wrongs may make a right here, at least for healthy individuals. Because if you get rid of the individual mandate, you expand these short-term plans, now healthy people can sign up for a short-term plan to last 12 months. If nothing happens and they're healthy at the end of that, they can just renew the plan. If they've developed a medical condition, then during the open enrollment period, they can just buy coverage in the individual market. So it becomes a really good option, possibly, for healthy people for 2019. So these plans are not guaranteed issue. They don't cover pre-existing conditions. They don't cover preventive care. They do have annual caps. So that's the negative. A lot of people are talking about these junk policies. I don't think they're junk policies. They do provide good coverage. I mean, it's, for somebody who's healthy, no, it doesn't cover pre-ex, but if you don't have a pre-existing condition, so what? They have lower deductibles, lower out-of-pockets, and lower premiums than a lot of the ACA plans. So, under the Obama administration, these plans were limited to 3 months. At this point, I think that, even under the Obama administration, some people said, well, still, the short-term plan plus the individual mandate penalty is still lower than the individual premium. Get rid of that penalty, and for some people, it becomes a no-brainer. So this is going to be our attendance check real quick. Do you expect to sell more of these short-term plans starting in 2019? Do you think this is going to be a good solution for your healthy individual clients? So if everybody could chime in there, then we're going to have about 2 minutes more, and we'll wrap this up. So again, give everybody a moment to chime in on this. And what it's looking like is, a few of you, more than a quarter of you, do not sell individual plans. So we're really looking at the rest, and we'll see what everybody thinks. All right, I'm going to go ahead and close the poll now. Show you the results. So looks like the majority of you that sell individual products do plan to sell more short-term plans starting in 2019. You do think this is going to be a good solution for your healthy clients, right? Okay, so ultimately what's happening is this. The market is becoming increasingly segmented, kind of like that game Perfection. If you looked at the different pieces, you only had so long to put them in the right slots, but there was a slot for every one of the pieces. Every puzzle piece had its perfect place, right? And I think that's what's going to happen with our clients in the individual market, right? It's becoming segmented, and it's really these natural divisions that were already there. We used to have a risk pool, and we had Medicaid, and then we had the individual market, right? So the risk pool was for the unhealthy, the individual market was for the healthy, Medicaid was for lower income individuals. We're sort of seeing those same divisions emerge, and basically it's going to become pretty obvious which solution is right for which client. Opponents of all of this, supporters of the ACA, say, yeah, but you're creating this parallel market. You're pulling the healthy people out, and they're not left in the remaining risk pool, and so all the sick people are going to have to pay more. And that was something that we were trying to avoid, with the Affordable Care Act. So now we have expanded Medicaid and, we have sort of expanded Medicaid and just people that qualify for the tax credit. That's sort of like the new Medicaid. So healthcare.gov and Medicaid is the new Medicaid. The individual market, for those not receiving a tax credit, basically the outside market, that's sort of the new risk pool. That's for the unhealthy people. And I think the healthy people are going to go with short-term plans because it just makes sense financially. Should we go back to the old way? I mean, some people are saying, well, if the divisions are there, maybe we should just go back to the old way. Maybe we should. Some say we shouldn't. Some say no, the Affordable Care Act, we need to fix it. I guess this is the argument I would make, just like in Jurassic Park, life finds a way, right? So does the market. Maybe we should get out of the way and let it happen rather than putting artificial restrictions on these solutions. A couple other things just real quickly worth mentioning. Association plans, we've done a session on this. We've got the final ruling on association plans. This could become a good solution for groups. It might allow some sole proprietors with no employees to join as well. So keep an open mind about that solution. Let's see if anything emerges, but that might be a possible solution for some of your small group clients that are business owners. Healthcare sharing ministries, I think that next year, whenever the mandate goes away, some people are going to bail on the healthcare sharing ministries and they're going to move more toward the short-term coverage. So if they're fully healthy, they can actually get a health insurance plan instead of, the sharing plan, and can, might be able to do so for a lower price. And then the last thing worth mentioning is some individuals can get group coverage. If it's a one-person group or a husband and wife group, if they own a business, they file a Schedule C and file a joint tax return, then they can actually sign up on a group policy, not with every carrier because different carriers have different rules on this, but it might be worth taking a look at. If you've got some individuals, when people are asking you for individual coverage, it's worth asking them, do you have a side business? Do you file a Schedule C? If so, are you married? Do you file a joint tax return? If so, you can get them a group plan. We've already seen group plans are going to be less expensive than individual plans. So remember that option as we're heading into the business. So we're on the hour mark here, so I'm gonna go ahead and stop talking now. But I really appreciate everybody participating. If you have any questions or additional comments, send me an email, eric@comedyce.com, and I will do my best to answer them. Otherwise, I just want to thank everybody for participating this week and listening to all these classes. Hopefully, you did get something out of them, and I hope to see you on a future webinar. Thank you very much. Have a good day.